Hello, I'm Rachael Beltran, a transplant nurse coordinator. I'm going to walk you through the liver transplant waiting list process and details. Once you're approved by the transplant team to receive a liver transplant, we will contact your insurance company for authorization and obtain labs to register you on the transplant list. Our goal is always to ensure that the sickest patients have access to a transplant opportunity first. That's why information about your medical condition will be routinely gathered by the transplant team to make sure that you get a transplant at the right time. Liver transplants are prioritized based on medical urgency through listing statuses established by the United Network for Organ Sharing, or UNOS. Status 1A prioritizes candidates who are acutely ill, in ICU, and will need a transplant within hours to days. These candidates will go directly to the top of the list. Status 1B represents acutely ill adolescent and pediatric patients. Most patients listed for transplant are listed under the MELD score, which stands for the Model for End-Stage Liver Disease. This mathematical formula is used to prioritize patients with chronic illness. It combines your labs for kidney function, clotting time, serum sodium, and bilirubin into a whole number that represents a patient's risk of mortality from liver disease without a transplant. The higher the MELD, the more urgent need for transplant. That number can range from 6 all the way to 40, with 6 being low and 40 being very sick. Patients with the highest MELD score will be at the top of the list and have the greatest opportunity for a potential deceased donor offer. Your MELD can change or fluctuate each time you get your labs drawn. Higher MELD scores mean more frequent labs and updates to your score. Your nurse coordinator will let you know when you need to have labs drawn to update your score on the transplant list. Some patients may qualify for MELD exceptions based on certain medical conditions. In these instances, a patient's lab-generated MELD score may not accurately reflect the severity of their disease. Exceptions may be granted for primary liver cancer or cancer of the bile duct, certain lung disorders related to your liver disease, or other genetic or metabolic conditions. Your provider will let you know if you qualify for a MELD exception at any point. There may be times that you need to be placed on hold while on the transplant list. If you have a change in your health or insurance status, or are unavailable to be contacted for transplant, you may be made temporarily inactive. If this happens, the transplant team can reactivate you once you are ready for transplant once more. When you are on the wait list and chosen for an organ offer, the transplant coordinator could call you any time of the day or night, so it's important to keep your phone charged, available, and provide your coordinator with any alternate phone numbers. The coordinator will make sure you haven't been sick in the last couple of weeks and will provide specific instructions, including where and when to arrive and what not to eat and drink. As always, we're here to answer any questions you might have. To learn more, visit uchealth.org/transplant.